what are the main treatment classes for each type?
So surgery is always considered a mainstay for any type of thyroid cancer whenever possible. Often patients will present with a lump in their neck that is noticed either by themselves or on physical examination, and is noticeable before the cancer has spread to other parts of the body. And that's definitely the best case scenario. If those cancers can be completely resected by surgery with either a hemithyroidectomy or a total thyroidectomy, then there's a reasonably good chance of cure in many cases. So surgery is first and foremost the treatment that we think about. Then for the subtypes of thyroid cancer that arise from the regular thyroid cells, namely papillary thyroid cancer, follicular thyroid cancer, oncocytic, and high grade, those patients will often also be treated after surgery with radioactive iodine. The normal thyroid tissue takes up iodine from the blood in order to make thyroid hormone. And we can make iodine radioactive, give that to a patient, and it can sometimes be taken up by the thyroid cancer cells, just like normal thyroid cells would take up normal iodine from the blood. And if those cells take up radioactive iodine, then they're killed off by the radioactive iodine. We know, however, that anaplastic thyroid cancers don't take up radioactive iodine, so we don't use radioactive iodine ever in anaplastic thyroid cancers. And then also in medullary thyroid cancers, because they're really a completely different cell altogether, those cancers are not treated with radioactive iodine as well.
Okay.
So most patients will need to have surgery. Many patients will also be treated with radioactive iodine. And for many, many patients with thyroid cancer, that's all the treatment that they need, and they're done. There are, however, patients who will have more aggressive thyroid cancer or thyroid cancer that's already metastasized to other parts of the body. And if those cancers don't respond to radioactive iodine, then we consider them radioactive iodine resistant or refractory, and then we have other treatments in the arsenal for those cases.
This may seem like a very simple question to you, but once the thyroid has been removed, doesn't the patient then have to take some sort of supplement for the rest of their lives?
Yes, exactly. So the job of the thyroid gland mostly is to make thyroid hormone. And thyroid hormone is one of the things that governs the body's metabolism. So if you take away the thyroid gland, then without thyroid hormone replacement, patients will become hypothyroid. And eventually it can be so severe that people can be quite ill. So anyone who's had a complete thyroidectomy will need treatment with everyone who's had a complete thyroidectomy will need treatment with thyroid hormone replacement for the rest of their lives.